Hello everyone. Today I would like to talk to you about how to eliminate very common folds in the MLR projection in mammography, that is to say those of the upper tissues, axilla and axillary extension, by showing you several photos taken of real models during a real examination. These folds are mainly due to these four reasons. The detector is not at the right height, the patient's arm and shoulder positioning technique is not adequate, but also because of the patient's stiffness, especially of her shoulder, and in addition, the laxity of the skin envelope, important for all type of folds in mammography. As for the right height of the detector in relation to the patient, remember that it varies depending on whether the mammography unit we are working on has the compressor shift or not. If it does not have the shift, the right height is the one where the patient's iliac crest looks towards the lower inner corner of the detector, as you see here. If it has the shift, the patient must be moved higher, and therefore her iliac crest must coincide with the lower inner corner of the FOV, as you see. We were talking in another video about the initial positioning of the patients in relation to the detector in the oblique projection. My advice is to position the patient medial to the detector, and then, once the breast is well picked up, guide the patient forward without turning her. In this way, view from the front and view from the back. Let's continue. We bring the patient well forward until she rests on the detector, as you see here. I recommend the two rotations maneuver at this point. The first, you lift the patient's arm, supinating her hand and rotating the arm in the anterior direction, that is to say, inside, and superiorly. You rest the arm again, pulling it forward. Make her bend her elbow well and rest her hand on the mammography unit. Do not make her squeeze the handle. Detail on first rotation inside direction, seen from behind. Better seen from the front view, see the direction, internal or anterior. Next step, second rotation. This is the maneuver that, if conducted correctly, eliminates folds in the upper tissues. One takes the arm, advising the patient not to move her shoulder, and performs a rotation directed superiorly and posteriorly. Then takes the arm with two hands and extends it forwards and downwards, and then rest it again on the mammography unit, elbow bent. This is the detail on the second rotation, external direction. And this is the final position of arm and shoulder. If the patient has a loose or very loose skin envelope, it will in any case be very difficult to completely eliminate the folds, just as it is difficult to effectively stretch and compress a breast that is very firm and hard to the touch. I would add this further information. Remember that in the case of patients with small or medium-sized breasts, small in height, using the large compression paddle will generally lead to a worsening of patient comfort and an increase in the likelihood of creating folds in the axillary cavity and extension. I hope you enjoyed this video. We'll post a real video on the documentation of the IMF with the real model in the next few days, hopefully. Thanks for your attention. See you next time.